Okay, so let's start the third part, which is basically Scheimpflug based camera system. So today I'm going to discuss about this principle, how it works, actually Scheimpflug camera, and then a little bit about information about machines and I think advantage and disadvantage of Scheimpflug camera and all these things. Okay, let's move. So So Scheimpflug principle is a geometrical rule that enables photographer to capture sharp focus images of an object that are not parallel, enabling to enhance the depth of focus without distorting image, and it's commonly used in photography. So what do you mean by that? If objects are not parallel, okay, and what we have is enhanced depth of focus without distorting image. So can you just imagine that cornea is parallel or it's dome shape? And if it is dome shape, then it's not definitely not parallel with the filming camera and camera lens and the film. So that will create a problem, isn't it? So actually, what ideally must have is ideally lens image plane are parallel, and the linear object will form the plane focus on the parallel lens plane, and thus can completely focus within the image. It means that object plane, image and lens plane, and image plane must be parallel to each other, so that the complete focus can be happen. But that's not the case with the non-parallel object, means the dome shape of the cornea. So it will create a little bit problem. So you have to understand why Scheimpflug principle is generated. So when object is not parallel, like uh, cornea, to the image plane, it is not possible to focus entire image plane parallel to the image plane. So means entire image plane cannot be focused clearly. So if that case in that case some part of the object is focused clearly, some part of the object is not focused clearly, which create distortion, isn't it? So what Scheimpflug principle does is Scheimpflug principle, it creates an object tangent that draw from the image plane, object and the lens plane, three planes, and their point of conversation is called Scheimpflug intersection, and that leads to focus of the non-parallel object. Okay, the, what is the precondition for that? That image plane, object plane, and lens plane, if they are not parallel, then also we can have focused image. But for that to be happened, these three plane, image plane, object planes, and lens plane must intersect at one point, and that intersection point is Scheimpflug intersection, known as Scheimpflug intersection, and that leads to focus of the image of a non-parallel object, which is cornea. So I'll show you pictures. Okay, wait, I'll come to this. So basically means what is ideal: object plane, lens plane, and image plane is parallel, isn't it? It will create clear vision. Whenever there is one thing is on parallel, like object is slanted, like cornea is dome shape, and then see its focus here clear green, and its focus is out of focus in the center, isn't it? That's why image is not good. But what we want from the simple camera is object plane, lens plane, and image plane intersection at some point. What if that point is called Scheimpflug intersection? At that particular point, see, this image is green is always good, isn't it? So all the point is focused there. So that's how Scheimpflug camera works. Okay, wait. Okay, in this picture, this is also clear illustration. See, object plane, lens plane, and image focus is always parallel. It's parallel in this picture, isn't it? It's parallel. So what happened is it's parallel. Focus, tip, center, and the bottom all are focused. Focused, focused, focused. That's easy. We understand. Whenever we change object plane or subject plane, then what happened? Three planes are not focused at one point. Definitely, it's not a Scheimpflug principle is not there. Then what happened? See, defocus and center is focused and tip is also defocused. You can use your mobile phone and see if it's happened or not. It happens. And we come to Scheimpflug intersection, that object plane, image plane, and lens plane, image plane intersect at one point. That point is known as Scheimpflug intersection. At that particular condition, if this condition is fulfilled, then what happens? Everywhere focus, focus, and focus. So that's the principle of Scheimpflug principle, basically. Okay. So let me tell you, Scheimpflug based system can either have single or dual Scheimpflug image. Okay, single or dual. So dual Scheimpflug camera based system utilizes two Scheimpflug cameras rotating at 90 degrees to each other, and that rotate around a common central axis containing slit beam sources, and that allows corresponding to corneal data from each channel and compared to average compensation and ultimately misalignment of the eye movement. So that's thing it does. What happened was single Scheimpflug camera. Then CCD camera rotates around the axis and captures 50 meridian pictures, and each passing through the common point of center of the cornea, and software extract 500 elevation based point from each image and obtaining about, see, 25,000 true elevation point each point. So, and which is machine done within less than 2 seconds. So that's the beauty. And you will know in later on. Sometimes some machines has dual camera, some machines have single camera. Like example, Pentacam have single camera, and Galilei has dual camera. It's so I think Bone series has mixed type of pleasure disc plus single camera. I think so. So that's it. So what is the advantage of Scheimpflug based system? Significant improved image, enabling the clinician to obtain optical section from the anterior surface to posterior surface. Basically, it's tomography, isn't it? So basically, it enables clinician to do the things. So measurement take around 2 seconds, which is very less, and minute eye movement can be captured and correction, which is very good, isn't it? And 3D image stitching, so basically multiple image is stitched to make one, and it's possible to measure 25,000 true elevation point. Okay, and precisely reproducible. So which is very good advantage. And another computer algorithm and mathematical model. So basically anterior and posterior elevation map, which is central important. So posterior elevation map, which is central important in case of keratoconus diagnosis. Thickness it can give, isn't keratometry reading, and corneal pachymetry, limbus to limbus, what's great. And even 3D chamber ACD chamber analysis, and even lens densitymetry can give. So it's very very useful. And let me tell you the disadvantage. So disadvantage is comparison of accuracy in different Scheimpflug machines is not possible there, as there is no gold standard. So you cannot compare Pentacam to what do you call bone series to Galilei. Is very difficult to compare each machines. Okay, each machines have different algorithms. This is the disadvantage, because if you know Galilei, then you when you move to Pentacam, it's very difficult. You have to understand a lot about a machine again. System extrapolate the calculate the data, and Galilei has changed the optical reference plane and the corneal power, and the anterior corneal surface decreases the value by 3%, and this respected previous to Pentacam calculation corneal power. So it's always better if you have one instrument and then compare with another. But you have to understand that it's value different, it's everything is different from one to another. So Scheimpflug imaging may be biased in imperfection, corneal clarity, and epithelial irregularity, and such a result false positive sense. It's always happens. See, if cornea is scarred, posterior elevation, you will find it's difficult. Posterior elevation value, it's not reliable. So basically, if there is cornea is irregular, yeah, cornea clarity, if there is a scar, or if there is epithelial irregularity, then yes, Scheimpflug camera doesn't work well. You have to understand this concept. So you have to understand before doing. Sometimes there is a scar and it looks like keratoconus because of that scar. It's always there. So that's why you have to seek in slit lamp to the patient's cornea. So that's very important. Okay, so now I am going to discuss about few things. I have referenced this uh, current development in corneal topography and tomography 2021 paper, and this I think I have to put this because it's very uh, useful. See, slit scanning, as I've already discussed in the previous. So light source is white flashlight, and that's called opscan second. So it's the first instrument now that gives the posterior signal. Scheimpflug imaging. So normally is blue light emitting diode and around this wavelength. So basically what CSO series and Oculus Pentacam देखने Chimera Galilei and Midwalk Scanis. These are the example of topographers. So I have worked with series a lot. And OCT based. What is OCT based? In case of OCT based supralumination diode of this wavelength, so you can see these machines too. In sweep source OCT based rapidly tuned laser with the wavelength of 1310. So these are the instrument. So you see this instrument commonly in clinics. Okay, so if you don't know anything, yes, so then read here, just pause here. Okay? And again, from the same paper, I find this in which is I think I shall have to put it, that corneal topography and ocular aberrometry mixed is called NIDAC OPD scan and Tracy eye tract. And corneal topography and ocular biometry used is top cone Aladdin and lens star LS 900. And corneal tomography, just remember this word, it's not written topography, it's written tomography, so which means basically Scheimpflug base. So Pentacam AXL and Zimmer Galilei G6 and Heidelberg Engineer Interior. And corneal tomography, ocular biometry, posterior segment optical coherence tomography, this is all found in optopole. And I think I have to put it so that you know about it. So, okay, so that why I put it. And obviously this comparison chart I have taken from the Sinjapsar's book, and it's basically this. Okay, so tomography in clinical practice, so fourth edition, I have taken this piece. See, what I wanted to discuss in this picture particularly is, see, topography, elevation based tomography and OCD based tomography. So three things we can discuss, and you know a little bit about the OCD based tomography too. See, coverage, what happens in topography? So it's 60, 67, 70. But yes, Scheimpflug based, definitely limbus to limbus. In OCD, definitely limbus to limbus. Central blind spot, there is definitely central blind spot, central cornea that is not measured in topography, but not in elevation based tomography, not in OCT. They take every point of the cornea. Evaluated surface, anterior surface only topography, but in case of Scheimpflug and OCT, both surface. That's a lovely thing. Okay, posterior surface, which is very important in case of diagnosis of any tactic disorder or refractive surgery. It's not going to happen in topography, but yes, definitely. And my goodness, it's always better with OCT, best tomography. It's always better. Okay, and another point, total corneal power is definitely with both of the things. Ray tracing for IOL, yes, it's definitely not in these cases. Pachymetry map and thickness, definitely not here, but yes, always remember thickness is always better with OCT. Thickness evaluation is always best with OCT, not with Scheimpflug based camera. Okay, epithelial stromal map, yes, in case of OCT, but not in case of Scheimpflug based camera. Angle kappa measurement, directly, indirectly in case of this, indirectly in case of topography is directly. Okay, tear film disturbance on OST, significantly affected, less affected, less affected. Okay, because topography is depend upon the reflection, that's why it's less affected, sorry, significantly affected, and these two are less affected by tear film. Tear film analysis in some device there, but yes, OCT there is tear film analysis. Affected by angle kappa, it will always affect if angle kappa is there, angle kappa is high or low, affect in every condition. So affection by misalignment, that's ultimate truth. If you misalign, then no mission will function well. So all tick tick tick. Okay, it's very important, this graph I have taken from the Sinjapsar's book, so it's very important. Okay, just go back and just see this chart and understand these things. Okay, so I think that's it. I have definitely have to reference this paper. It's very good paper, I think. Grab it, very good book, Sinjapsar's book, and I think I'm fan of this book. and this 2 also. Okay, so I think Bistan choose.